Good morning, everyone. I am Philomena Robertson, Press Secretary. Thank you so much for joining us for this week's Post-Cabinet Press Briefing. Thank you to members of the media who are present this morning and also to our listening and viewing audience for tuning in to this weekly press briefing hosted by the Government of Grenada. This morning, we are going to be speaking about COVID-19. I have with me Health Minister, the Honourable Nicholas Steele, and Acting Chief Medical Officer, Dr. Sean Charles. We will start with Dr. Sean Charles, providing the latest on the epidemiological situation that we are currently faced with here in Grenada. Dr. Charles, over to you. Good morning.
Good morning to you, and good morning to the viewing and listening audience. So I will briefly summarize the situation as it relates to cases of COVID-19 here in Grenada thus far. So to date, we have confirmed upwards of 230 cases. What is of significance to us is that we currently have 44 active cases recorded, and out of those 44, only 7 are imported cases. So the vast majority, 37 of them, are local cases, persons who have not traveled. Yesterday we added 5 new cases. Currently, we had 1 case in hospital that was released yesterday. There was 1 individual who was subsequently admitted to hospital with suggestive symptoms, and they are pending PCR confirmation. So as it stands, we now have 44 persons in isolation and are being followed up by our health officials. And we still have quite a number of persons in quarantine, and testing and contact tracing and all the other activities continue. Now, just a bit on the local cases that we have. So far, out of the 37, we have 4 who are vaccinated, 33 non-vaccinated. 22 of these 37 have symptoms. 37, we have 4. All right, so 22 of the 37 presented with symptoms. Out of these is 2 of the vaccinated and 20 non-vaccinated had symptoms. So 2 persons among the vaccinated had symptoms, and 20 among the non-vaccinated had symptoms. These symptoms included body aches, headache, congestion, runny nose, cough, and fever. 5 of these individuals presented with fever. Several parts of the country are affected. The parishes of St. George, we have the Northwest, we have the Happy Hill, Molyneux, that area, the Northeast, the Vendome, Willis, New Hampshire area. We have St. John, principally in Guelph. We have St. Andrew. St. Andrew is a bit varied because we have cases from 4 different villages in St. Andrew. So we continue to monitor the situation, and we continue to remind the public that this is the scenario that we have been speaking about for months, and it is in our hands to ensure that it does not get out of control. I'll pause here for now.
Thank you very much, Dr. Charles, for bringing us up to speed on the current situation in Grenada as it relates to our status with COVID-19. I'll turn over now to Health Minister, Honourable Nicholas Steele. Good morning to you.
Good morning, Philomena, and good morning to all of our viewers and listeners out there. Dr. Charles has given the update. We continue to monitor. We are under a state of restricted movement, and this is for us to get on top of this situation as best as possible. As the days go by, we will get more and more information based on the number of positive tests that come forward, and we'll be able to make a determination based on the rate of increase of those tests, etc., as to how we proceed. How and when we get out of this is going to be based on us all, as we have consistently said, and not just up to the Ministry of Health. We will do as best as possible, but it is our own individual habits that will get us through as a country or not at all. Now is not the time for blame. I think we are very much aware that we're all in this together, as we've said from day one. Now is the time for us to get past this. Now is the time for us to report if we have symptoms, to be brave enough to step forward if you know you've been in a place of high risk, so that you can be tested to determine whether you have been exposed or not. What we don't want is for you to believe that there's a stigma, that there's going to be blame, or there's going to be reprimand or so, and you keep it quiet, and in keeping it quiet, you allow it to spread within your own household. And maybe one of your vulnerable family members who lives with you ends up getting the virus, not knowing how, because they never left the house or so. So please, if you know that you have been somewhere and possibly exposed, call our hotline, come in to be tested at one of our centers, but call first. We don't want people just coming in. But also now is the time to come in to be vaccinated. That we do want you to do. All of our health centers, and we will be having pop-up vaccination centers too. GIS will be announcing the list that has been shared with them in the last couple of hours or so, so we will be putting that out. But at the end of this program too, we will announce where those pop-up sites are and where the consistent sites are. So this is the state of the world today, not just Grenada. There is not a single country in the world. We have held out an extremely long time, and the team that has worked on that, and us individually who have done our part to keep COVID out, needs to be congratulated. But we need to recognize that this Delta variant is a whole different virus, literally, in terms of its level of contagiousness and how it spreads. So this is our reality, as I said, and we are going to deal with it because we're all in this together. We're going to deal with it together. Thank you.
Thank you very much, Minister Steele. It is now time to turn the floor over to the members of the media who are present. Again, thank you for joining us this morning. I can see that we have present this morning, we have MTV, Rena Pear from GBN, Nancy Maguire, Mikey Hutchinson, Linda Straker, Callistra Faria. Anybody on the floor ready with questions this morning?
Yes,
Mikey,
good morning. I'm Kellen Bubb representing the Bubb Report.
Mr. Bubb, good morning to you. I threw the floor to Mikey Hutchinson first. We'll come back to you.
Okay.
All right, good morning again. First question I have, are we able to say definitively now that there is community spread of the virus in Grenada?
So we continue our investigations in the community to find out where these cases are linked. Where, if we are unable to find a link for these cases upon investigation, then we will make that determination as to whether we have community spread.
Mikey, is there another question from you?
And in terms of the outstanding test samples, how many do you have awaiting to find out whether or not these cases are positive?
And testing is ongoing as we, at this very moment, we have our teams out there testing individuals. So I will not be able to give you a number. In general, we do upwards of 200, 250 plus PCR tests daily. All right, but it is an ongoing process. Yesterday we did upwards of 250.
Thanks a lot.
Thank you, Mikey. Linda Straker, good morning.
Good morning to you, Philo, and Minister and Dr. Charles. I have a number of questions. I'm going to start with Dr. Charles mentioned about the hospital scenario. Can he clear that up for us? Was that person a patient came in for some other care and happened to be diagnosed with COVID? And if that is the case, what happened immediately after that person was confirmed, as well as to what happened to the other patients on the ward, if that is the case? My other question is, what is the timeline for a person to receive the test after they would have placed a call to the hotlines? As media, people call us and complain about a whole load of things. And one of the complaints I got a lot of on this weekend was calling the hotline, no answer, calling it and say that they can only come, giving them days after. Like one person would have called Friday and was told, we could only see you you have to wait until Monday. And that was the person who claimed that their children and their home had a lot of symptoms, or displaying a lot of symptoms. And my last question for now is, what is government approach, or the Ministry of Health approach, to curbing the spread? Because we are now, Dr. Shan a while ago mentioned a couple of villages and communities, which the only parish I haven't heard mentioned yet is St. David's. So what is government approach to curbing the spread? And can he also tell us how much samples was recently sent to CAFA for testing to confirm that indeed that it is the Delta variant that is spreading through Grenada and not the Alpha? I await. Thank you.
Yep, Linda, let me take the questions about curbing the spread and the hotline. Curbing the spread is the same as before. What we didn't do is what caused the spread, which is follow the protocols. If we don't continue to follow the protocols, then it will continue to spread. It's this Delta variant, as I said, is literally a brand new virus because of its level of infectiousness. It's unforgivable. We've had instances before of positive persons being in the presence of other people, without masks, etc., and they weren't infected because it wasn't Delta variant. The Delta variant does not forgive. So government's plan is the same as all government's plans, to vaccinate the population so that we can create a level of immunity and a buffer there, to prevent movement and mass gatherings, and to have people follow the protocols. If we do those things and we can achieve all of those things, then we will stop the spread. If we do not achieve all of those things, then the spread will continue. On the issue of the hotline, like any other aspect of this, is based on a moving target and time. We need to understand that we moved from 2 or 3 people having concern as to whether they were infected to thousands of people calling. And our initial response immediately is, the Ministry of Health is not answering. The Ministry of Health said, like all ministries of health all over the world, if this thing gets mass outbreak, we're not going to be able to control it. So those of you who are calling in on the hotline, you need to recognize that's going to be the same thing in a couple of weeks if we do not get control of this, with you calling 911 for the ambulance. There are just not going to be enough ambulances or people to answer the calls if we do not get control of this, which is the same that happened in New York City with all of its resources, in all of the first world nations where they lost control, in India, anywhere else. So we need to recognize that Grenada is not going to be any different. It's not going to be any different with respect to what we experience unless we change as quickly as possible, which is why the government, as quickly as possible, we put restrictions on, which is not a pleasant thing, to minimize the movements, social movements. The individuals who are being infected, it shows we're following that correct path. It's from social interaction, not work interaction. That's where people are being infected. That's where you want to slow that down. So we need to be very conscious that yes, because of mass activities and super spreader events, the system, like any other system, is going to get inundated. We have added more lines over the weekend and into today, and will continue to adjust accordingly. But if we as a community do not adjust accordingly for ourselves, we are not going to get control of this. We will get to individuals to test them. But again, we've moved from 2 or 3 in a community to thousands making requests. And you are asking the same healthcare workers that ask you not to and take the precautions, make sure you react and come to my house as quickly as possible to get me tested. Have been performing like super men and women, but they are not. So they will do their best, and they will get to you as quickly as possible. But in the interim, stay indoors, stay isolated if you think you have been exposed, and wait for us to get to you as quickly as possible. If you develop symptoms, report them, call 911, and let the individuals know immediately that the symptoms you are experiencing are because you think you are exposed to COVID-19.
Right. With regards to patients needing admission to hospital, remember, once COVID is in your community, anyone can get it. And when there's a scenario where anyone can get it, then if there is any potential exposure afterwards, then what you're doing is you are following up, and you're chasing down to make sure that those who were exposed were identified and to verify infection. Now, generally, when someone comes to the hospital presenting with symptoms suggestive of COVID-19, those persons are admitted in isolation while we're pending. So this is what has occurred in this scenario. All right? Person was admitted, placed in isolation. If at any point it is felt that persons were exposed, their contact information will be gathered for follow-up. I also wanted to respond to that question with regards to persons who are calling and they're anxious and they want an almost immediate response with regards to testing and so on. We spoke about this. We did try to carefully explain to the public that COVID-19 is something that can overwhelm any healthcare system. So when there is a concern that someone has some flu-like symptoms in a family and persons call, all right, in an attempt to get tested or so, immediately understand that the system cannot immediately respond to 100 such calls at the same time, all right? It simply cannot. So there will be delays, and these are the things that we were carefully trying to explain so that we would not get to this point. But we are here at present. So what I'm asking is for all of those persons. Yes, I understand that you're anxious, all right? Just understand that we are working to the best of our ability right now. Our healthcare team is out there. They start early in the morning, they finish late. All right? And these are persons who are going at it for months. All right? They've been going at it for months. All right? And they encounter all sorts of scenarios out there, because they do get to homes and test individuals. And one thing I want to mention is that they are facing a great deal of abuse from some of the persons that they go out to test as well. I had to mention this this morning because we have different persons in this society. All right, and the unfortunate thing is that all healthcare providers have to, face the wide variance of different personalities here. All right. So in addition, they're working on the these different kinds of strains, which are unnecessary, especially in a time like now. So just understand that there will be delays. All right. There will be delays. What we have observed, persons, the symptoms that have been presenting, they've generally not been too severe, but we do understand that persons are anxious. But they need to understand our perspective as well. All right, it is a challenge on our side as well. Thanks.
Thank you, Dr. Charles. I think there was also a question on the number of samples that have been sent to CARFA thus far for testing.
All right, so we have 2 sets of samples that we send down. We send down first a shipment of 4, and then on Monday we sent 7. All right, so we are waiting on these 11 samples. Now sequencing takes time. All right, the results generally take up to 2 weeks to return. So we'll find the answer in the next few days.
Let me just say on that, though, because it's a valid question that keeps coming up from the media in terms of presence of Delta variant and the sampling and so. Everywhere else in the world, the Delta variant is a dominant strain. So we expect it to be the same here, that the significant majority, if not all of the cases, are going to be Delta variant, because that's the variant that is spreading.
And not to mention, the previous 3 results that were received from sequencing from CARFA were confirmed as the Delta variant.
Thank you very much, both the Minister and CMO. Kalishta Faria, good morning. Ms. Faria, you have the floor. Please go ahead. Okay, so we move along. Rena Pear-Thomas, GBN, do you have your question ready?
Yes, I do. Good
Go right ahead.
morning to everybody.
Good morning.
My first question, the FDA decided to grant full approval on Monday for people 16 years and up to take the Pfizer shot. Monday approval doesn't cover 12 years and 15, or 12 years to 15. But other than that, they also did give that age only for emergency use. So why do we have 12 as the standard age requirement? My second question is, we received reports that there are less than or at least 4 persons currently hospitalized with COVID-19. Can you clarify that? And there seemed to be some miscommunication among some health officials. Some people are being told to go to the nearest health center for testing after calling the hotline. So just to clarify for us again, what is the procedure? And Dr. Sean, you didn't mention the different areas in St. Andrews. Could you do that for us, please?
All right. So up till yesterday, the Pfizer vaccine had a EUL, or emergency use authorization from ages 12 and up. All right, so let us not confuse the issues. The Pfizer vaccine had EU emergency use authorization for ages 12 and above. Yesterday, the US FDA granted full approval for 16 and above. So all that changed is that now it's full approval from 16 and above, but the EUL from 12 remains. So, I mean, that is the situation. It is not a change from what previously existed. What we now have is full approval from age 16 and above, and a continuation of EUL for 12 to 15. Okay. So I hope that cleared it up. Now, in my opening presentation, I presented that we had one case admitted yesterday. The individual was released, he was discharged from hospital. We have subsequently admitted one individual, and they are pending confirmation. The individual has suggestive symptoms, all right, and a positive antigen. We are awaiting confirmation with PCR for that one individual. I am not aware of any other information. In fact, the first time I'm hearing about those numbers are when the question was posed. And I don't recall the third question. What was the third?
It was for clarification of the steps after calling the hotline, because some persons are being told apparently to go to the nearest health facility.
All right. So let me give the advice. If you have symptoms, you should self-isolate at home. Do not leave your home. Do not go out in public and expose others. You call a hotline, or you call your nearest health facility. All right, so that we can make the assessment and organize for your testing. We are not encouraging anyone who has suggestive symptoms of COVID to leave their homes at any time, take public transportation or whichever, go to a healthcare provider or a health clinic where they will encounter the elderly, the pregnant, young children, potentially expose all of these individuals just to get a test to see if they have COVID, and especially when their symptoms are not life-threatening. So this is the situation we want to avoid. So the advice is to call, self-isolate, wait. That is the advice. I hope that has been clear. What we are trying to do is to prevent the spread of this disease. And this disease spreads from person to person. If you are positive and you go out into public and you encounter other individuals, you will pass it on to them. And then they might pass it on to their families and their co-workers. So that is the advice. I hope it clarifies.
I think that's pretty clear now. There is also a question on the specific areas in St. Andrews that we have seen positive cases from.
Let me address that, and we need to be realistic. Grenada, the size of Grenada, it matters not whether it's St. Andrews, St. Patrick's, St. John's, St. George. It matters not. What's the length and breadth of this island? It's 122 square miles. It's different when you hear on CNN this state, New York State, as opposed to Florida State, as opposed to California. But in our little precious, beautiful Grenada, it really does not make a difference whether it is St. Andrew, St. John's, St. Mark's, St. George, or St. David's. It's in Grenada. And I think that is the key thing. it's in Grenada. So the questions of which village, no, we know on a daily basis, most of us, move across this island from village to village, passing through, etc. We can walk, and our neighbors do, back and forth. So we need to stop asking that, to think that there's some way that we can isolate, or that we can still breathe a breath of fresh air because we're in St. David's and there are no reported cases from St. David's as yet. No. Let's be realistic. COVID-19, Delta variant quite likely, is in Grenada. So we need to act accordingly, all of us, regardless of where we live and work.
Thank you, Minister. Kellen Bob, good morning to you.
Yes, good morning. I have two questions and probably a follow-up based on the responses from the two individuals, the Minister and Mr. Charles. The first question is having to do with the current quarantine period for visitors and returning nationals. Are you going to be giving consideration to making adjustments to what that currently looks like? Based on the recent reporting from your ministry, 2 people were tested positive after going through that period of quarantine. So I need to know whether or not there will be any adjustments to that quarantine period, if you're giving consideration to that. My second question has to do with back to school and reopening operations. Is the COVID committee going to be making any adjustments or any changes with respect to what back to school would look like, given the current epidemiological profile of COVID on the island?
All right, so I don't want this issue to be a red herring, because the issue really is, if COVID is in your neighborhood, how does changing the quarantine at the port of entry protect you from getting it from someone in your neighborhood? I think there's an overemphasis on this point without really thinking it through. COVID is here. It is in many parts of the island, many of our neighborhoods. One thing we do not want to give is a false sense of security that if we put a quarantine, if we move all quarantine into Grenada for 10 days or 21 days, that we are somehow protected. Persons must focus on the fact that we are here now. The disease is here now in our communities. It's not in someone else's country and we're trying to prevent it from come here anymore. All right, that has changed. That has changed. There are countries who have had 14-day quarantines and community spread has developed. What matters now is what each individual does to protect themselves, not what quarantine is put at the ports of entry. Because how does that protect you from getting COVID from someone on the bus when the disease is spreading in your local neighborhood? All right, what we should focus on is adhering to the prevention protocols, distancing, wearing a mask, sanitizing, avoiding crowded settings where the disease can spread easily, getting vaccinated so that yourself and your family are protected. That is what is important. This focus on the quarantine must be seen as what it is. All right? It is as if the state can, by that one decision, change the quarantine, make COVID magically disappear. Unfortunately, we have to be grounded in reality now. When it's next door, It does not matter what is happening at the port. All right? Focus on what you need to do for yourself and your family to prevent this disease. Now, with regard to back to school, I would just say briefly, we will look at the risk, and we will make the appropriate decision. One advantage that we do have now, we do have a vaccine that can protect those 12 years and over. So we encourage parents, like I did, we encourage parents to get their children vaccinated. All right? My children are vaccinated today. And I'm very happy, I'm very pleased about that, because I would like them to return to school in September. All right, have some semblance of normalcy in their life and in their education, and not have to worry that they may pick up something in school and have some, and that will affect them adversely. So that's the decision I took to ensure that my children can go back to school in September, and I hope that other parents will do the same. Thank you.
Thank you, CMO. Callistra Faria, we're coming to you again. Are you there now?
Yes, I'm here. Thank you. The people who are in isolation, the positive cases in isolation, what is the treatment protocol for them? How are they being treated? How are they treated? And the one person who was hospitalized, what is our treatment protocol there as well? And on the issue of the 2 days in quarantine, is that a science-based policy? Because we are, Dr. Charles said it doesn't matter what we do at the port. But I am thinking here that if we are trying to control this spread within our borders, having that risk continue while we are trying to deal with something on the ground might further create problems. We run the risk of adding to our numbers by keeping the 2-day quarantine, is my assessment. I could be wrong, so can you explain, please, why the 2-day quarantine does not matter, especially when people might be coming in with infected and not having sufficient viral load for it to show up in a test of a sample that's taken. On their arrival, they might have been infected 6 hours before while in transit. Thank you.
As you're aware, the treatment for COVID, there is no drug that kills the COVID virus. All right? Treatment for COVID-19, basically it's symptomatic. All right? You would treat the symptoms. But of course, there are established protocols for treating this condition in different settings. So for persons with mild symptoms, there's no treatment really is necessary. All right, if you have fever, you use some antipyretic or something like paracetamol or such to bring down your fever, rest, fluids. For persons who may be moderately to severely, who have moderate to severe disease, they may or may not need hospitalization. They may be hospitalized, given oxygen therapy, and treated based on what presents. All right, so they may receive oxygen therapy, they may receive steroids, they may receive antibiotics to treat other infections that may ensue as a result of, COVID's ability to weaken the immune system by its assault on the body itself. All right, they may even require ventilation. All right, but all of it is based on the patient's presenting condition.
just add on the question of the quarantine, entry quarantine. The entry quarantine that we have had has been in existence for months. It is one of the more stringent quarantine levels in terms of time in the entire OECS and CARICOM. And it's been working. I think we need to be honest. We need to be honest and ask ourselves what changed in the last 3 to 4 weeks. What was different? We didn't bring this 2-day quarantine, 48-hour quarantine, and a 72-hour travel test in the month of August. We didn't reduce the quarantine in the month of August. We didn't change anything in the quarantine in the month of August that wasn't there in the month of July, in the month of June, in the month of May, all the way back to March. The quarantine has been the same, and it has been working. And we have consistently said, while it has been working, it is not 100% foolproof, and people may get through. We've had conversations here about people trying to bring in fake vaccination cards, fake tests, not just here in Grenada, but throughout the world. So we need to recognize the only thing that changed in the month of August is the mass carnival activities, so that we've been dodging that bullet where somebody may have snuck in, got through illegally or so. They're not interacting with a couple hundred people in one location. So I think we need to be honest. Members of the media, please, let us be honest as to what has changed in the month of August. That is a plausible explanation as to why we are where we are. The quarantine period has been in effect for months.
Thank you very much, Minister. Members of the media, I note that several of you have follow-up questions, but I'll go to Nancy Maguire and then Nigel Matherin, because they have not had an opportunity yet. Nancy, good morning to you. Please proceed.
Thank you. I have a question about the vaccination and the release that the government put out regarding the arrival of the Pfizer vaccine. Do we have to have appointments to get that vaccine? It was also noted too that the priority, or the first to get, will be frontline workers and the children. So what is the time frame for those to get vaccinated, and then others that want to get that vaccine? My second question goes back to the issue of the villages, and respectfully, I would think that once people know that it's in their neighborhood, and I know we're a small country and it's in the country, but people want to know which villages. And if we name Happy Hill and Molinare and Lewis and New Hampshire, we need to name St. Andrews with respect. Thank you.
All right. So I hope we're not getting some things confused. Now, I did mention a limited number of locations because of the significant number of cases that came from these areas, because these were the areas where we see many more. But we do have one pop-up in that village, and one in another village, and one in another village. All right. Please let us focus on the fact that COVID is here, and it can affect anyone. The person sitting next to you that is not wearing a mask, can be the person that is spreading it. So let us focus on the bigger picture, and let us focus on the bigger picture here.
I think, Nancy, your point is a valid point. So we can see if we can, over the next couple of days or so, we can give the number of cases per parish or so. with the one caveat that if you don't see your parish or your village mentioned there, don't think that you're safe. I think that's what Dr. Charles is saying. But the villages that he mentioned in the beginning are, as he has said, those areas that are becoming hotspots, so to speak, that we're seeing more than one, more than two, more than 5 cases or so. But if you want us to mention all, it is going to take a little time. We can release that information to GIS, and they can show you, okay, 1 case showed up in St. David's or 1 case showed up in a certain village. But just the main underlying message there for us is don't take it for granted that if your village isn't named, that your village is safe. We all can only be safe by taking the necessary steps.
And there and mind you, there are other villages in St. George's where there's a case. All right, like I said, I did not mention all of them. I just stuck to mentioning the more important ones. But there are other villages in St. George that are affected as well. All right. With regards to the Pfizer vaccine, as we have said, the vaccine is available to everyone that is 12 and above. All right. We will give priority to children, frontline workers, persons who have underlying health issues, because these are targets of vaccination. All right. We are not turning away anyone. All right. If we do have children and adults and persons waiting, they may simply be moved a little closer to the front of the line than others. But at the end of the day, everyone will receive it. Now, for persons seeking vaccination at the health centers, now the health centers have all of the routine health services that are going on at the same time. We have child health clinic, we have our antenatal clinics, we have postnatal clinics, we have our chronic disease clinics. All we ask is that persons who are seeking to get vaccinated at the health centers, you call ahead, you make an appointment, you put down your name, so that it does not disrupt the other services that are occurring there. All right? Because if a large number of persons descend on a clinic at the same time, it can create, some situations. Otherwise, you can go to any of our outreach clinics that are occurring. We have one that is continuous at the stadium, 9 a.m. to 2 p.m. every day. You do not need to have an appointment. You just show up and get vaccinated. So I hope this clears the air on that.
Nigel Mathlin, good morning to you.
Yes, good morning. Grenada began administering COVID vaccines about 6 months ago in February, and to date, more than 20,000 people have been vaccinated. Has the Ministry of Health recorded any serious adverse reactions, hospitalizations, or even fatalities? And is there a system put in place to record and report on this? I don't recall in the past 6 months of any reports being sent out regarding adverse reactions. My second question, there's a pop-up vaccination center which I think is in place in Willis this week, and that is pretty close to the health center in Willis. I'm just wondering if there was any particular reason for setting up another facility in such a small community. And my last question regarding the hotline and the challenges that people have been having in calling and reaching people at the hotline, is there any other way that people can reach out? Many people don't even have landlines or fixed lines now, for instance. So even calling and being put on hold for a long time may be a problem. So can people message or call by WhatsApp, or is there any other avenue that people can reach out? Thank you.
So yes, we've been vaccinating since February, and the Ministry of Health has not received any report of any severe adverse events following vaccinations. There have been persons who have experienced different levels of symptoms. The majority are mild, all right? Very rare individuals would report symptoms that are moderate. All have recovered from these symptoms, which were temporary following vaccination. So we do not have any reports of severe adverse reactions following vaccination or deaths following vaccination as a result of the vaccination. We do have a system where we record the same electronic immunization register that we use to record everyone's vaccination information. Also includes a section or a module where adverse events are recorded. Now, persons who have their vaccination card, if you flip and you turn to the back of your vaccination card, you would see that it gives some directions as to what to do if you're experiencing symptoms. There's a number there that you call to report, all right, and the person records the information and puts it in the vaccine information system. Now, with regard to the pop-up clinic, the location that was chosen, and this is my opinion, the location would be based on where the team believes that it would reach its targeted population for vaccination. So where persons are more likely to come and access the vaccination. That is the thinking behind setting up the pop-up at that location. Of course, they could have utilized the medical station, but I think the focus here is to make it as easy as possible for the persons living in the area to access, and hence the reason why that was chosen. Other ways to reach out, like we said, persons can call the hotline, or they can contact their nearest healthcare facility. We have medical stations and health centers located throughout the community. All right, those can be reached by telephone, all right, throughout the day. So if someone is having difficulty with the hotline, they may try calling the local medical station or health center. But remember, we spoke about the limitations in the system. All right? At times, persons will call, all right, and they may have some challenges getting through because many persons are calling, or because our team is stretched doing other activities as well. So please bear these in mind. Thanks.
Thank you, Dr. Charles. I have a question here from a member of the media who was unable to be on the call. However, he's asking about any monitoring mechanism that's in place for persons awaiting their PCR test results. Apparently, there's some concern that, people carry on their normal life while awaiting the results.
Well, you see this, and you see this is where the real focus should be. Because our ability to control this outbreak would be based on the public's willingness to obey the instructions that they're given. And the instructions that everyone who is a contact is given is to self-isolate at home, all right? And you get tested. You have to continue to self-isolate and wait for your results. And when you're told that you're positive, you have to continue to self-isolate while we monitor you and until you're clear. We do not have the resources to station someone at every home in Grenada to monitor persons. All right? It requires a high level of personal responsibility, and we all must be our brother's keeper. All right? If you know that you have symptoms, why would you want to move around and possibly infect someone else? We have to display some level of care and concern for the persons around us. All right? And that is what is needed. All right? If we don't get that, then we would have lost.
I think just to add to that, we cannot expect that the Ministry of Health is just going to lock up and remove anybody who is suspected of COVID-19 so that the rest of us can continue without being as responsible as possible. We all have to do our part. Yes, we have noticed a couple individuals who, between being told they're possibly exposed and us taking the swab, and while they were awaiting their test results, that they did not comply with what was specifically told to them. I know that the CMO himself had spoken to one or two of these individuals. And this is not something new. Everybody for a year and some, we're very much aware that if you think you're infected, you isolate yourself from the rest of your family, and most definitely from the rest of your village or society or so. It really should not be that the Ministry of Health has to send a health police, so to speak, to make sure that you're there, that you stay. We really do need people to be responsible. If you were not responsible before, or you dropped your guard, it's been around for 15 months. We're tired. We're all tired. Our health team in particular as well. But unfortunately, it is 15 months later that we're going to face our toughest battle when we are tired. But the silver lining on that is that we haven't had to deal with it earlier like other neighboring countries have. But this disease is going to follow a similar path if we as a society follow a similar path as well. We saw our neighbors in Trinidad. It took months for them to deal with it. We see our friends and loved ones in St. Lucia, St. Vincent, Antigua, Dominica, Jamaica. We're not going to be any different. It's for us to take the necessary action as a community, as a village. Don't wait to hear your village named as a village with COVID-19. Take the actions before and make sure COVID-19 does not get an easy chance of getting into your village. Don't wait for your household. Don't wait for your business place. We do need to assume that it is there wherever it is that we are congregating, and we just haven't picked it up as yet. Get vaccinated and follow the protocols. That is what we all need to do our part. Get vaccinated and follow the protocols, and we will get through this.
Okay, we're coming up on 11 o'clock, but I'll take just a couple of follow-up questions. Mikey Hutchinson, please go ahead.
All right, thanks again. I'm hearing a lot of what I would call a selective reasoning. We're not naming villages, but we are naming jab, and I just think it's unfair. But let's go to what the minister has been speaking a lot about personal responsibility. And in a recent picture that was out, the minister was seen with a movie star and about two other individuals not wearing masks. How does he see that affecting the message that he's sending to people? And that's one of my questions. And the second one is, I know that there's a lot of skepticism in people who want to come forward to be tested because they're thinking that they have to pay for those tests. Can you clarify whether or not people who call to the ministry to be tested, that they have to in fact pay for these tests, or they will be free?
Yep. Mikey, I had a conversation with the Commissioner of Police And as far as I'm concerned, there is public evidence that I was not wearing a mask, and I await my ticket, and I will pay my charge. The law and the regulations we put out there is for everybody. And those that were in the vehicle are going to do the same. So the law is for everybody. I will pay my charge. I will receive my ticket for not wearing a mask in public. And we will move forward. And I expect any and everybody else to follow by example as well. It's been 15 months that we've all been dealing with this. And yes, I dropped my guard and I wasn't wearing my mask, and therefore I will pay the consequences.
So, with regards to your question about payment for the test, now when we do testing, when we do testing for public health functions, for public health purposes, persons do not have to pay for the test. All right, and I'm certain that the hundreds of persons that we have tested during our contact tracing can attest. There is no cost. The state bears the cost of PCR testing for public health, when we test for public health purposes. All right, so for all those individuals who are uncertain, there is no cost for the PCR test for persons that we pick up during our contact investigation.
Linda Straker, you also had a follow-up. Please proceed. Linda, are you still with us?
Hello. Yes, I'm here. Dr. Charles, can you just clarify, is it for persons who are only picked up to contact tracing, or a person who believe that they have been exposed? Because that's two different types of persons. I may feel I've been exposed because I hear this person is positive, but there could be a scenario where you come directly to me and say, as part of our contact tracing, you have been exposed. So clarify that, please. My other question has to do with pregnant mothers. Can you just explain to those who are pregnant and out there and getting ready to deliver, at what point in time would they have to do the test before they go to deliver the baby at a hospital? And if there is an emergency, what happens to that person if they do not have a PCR test result with them? And finally, the uptake. Since you made that announcement last week that we would have had this mass vaccinated, and also whether or not since the availability of the Pfizer, there has been an uptake of persons showing a willingness to take the vaccine. And would there be any consideration to reducing on transportation numbers? We use a lot of Grenadians still use public transportation, and buses are still rammed and crammed. Is there any consideration, maybe from the advisory body or so, to reduce on the numbers going forward?
All right, so I hope I understood the question. So if someone was exposed, I am hoping that you are speaking about being exposed to a case. Then no, we do not. There is no cost for testing. All right, for persons who are exposed. With regard to pregnant mothers, and with regards to emergencies in general, because an accident can happen at any time, and persons turn up in hospital. When they get to hospital, we have our procedures. They will be tested. All right. So that should not be an issue, because the hospital has to stay functional, has to stay running even throughout this process. And with regards to the uptake, I mean, it's very early to determine whether there is an increased uptake. I mean, we just started using Pfizer yesterday. All right. So let's see by the end of the week what the numbers look like, and then I will let you know. But I certainly know that there is interest There is interest from many individuals. There are even persons that are calling to ask, can they get a booster? All right, so there is interest. So as time goes on, we'll be able to give you that information. All right, because one day does not make a trend. We have to see what happens. Thanks.
I think there are three things that we've seen, not just here in Grenada, but almost worldwide. 3, maybe 4 things that affect vaccination or rate of vaccinations. The availability, first off, of vaccines, and we've had vaccines available in Grenada since February. The public awareness, public education process of vaccine or vaccinations, and we've been doing that since January consistently. The threat that the population perceives from the disease, and that has been waxing and waning and changing, so we do expect to see some people coming forward now who have been, and there have been many people out there who have been saying, I'm okay with the vaccine, I'm just not ready yet. So we expect some of those to come forward. And then also options. So there have been many people who have said, I will take a vaccine, I just don't want to take the one that you have at this point in time. So having the Pfizer vaccine, yes, we have seen more individuals come forward as well to say, now that you have Pfizer, I'll take Pfizer, I just didn't want to take AstraZeneca. At all of the vaccination centers, as best as possible, we make sure that both are available. And this is unique. I know in Canada and many states in the US, you don't necessarily have a choice. What is being disseminated on that day is what you get when you get an appointment, particularly in Canada. We're making sure that we have a choice because we want to get as many people vaccinated as possible. The public awareness will continue, the pop-ups will continue. Nigel asked a very valid question as to why I have a pop-up so close to. The decisions are being made by the community and in the community. So I'm going to check on that as well as to see if there's somewhere else we could have gone as well, maybe, or so. But those are the things that are going to influence vaccinations. So we will see. And there are some individuals as well that the fact that Pfizer is now fully approved, they're going to use that as an added incentive or reason for swaying towards Pfizer. So numerous things that cause, and we are monitoring them, and we will report as to vaccine uptake.
CMO, I think Linda also had a question on any reduction in transportation numbers.
I'm assuming that she means number of persons being carried in a bus. Let's put it this way: we know the type of transportation that we have in our setting. All right, it is impossible to achieve, the adequate distancing inside of the type of public transportation that we have. If we are to do that, it would just be the driver in the front and one passenger in the back. All right. What is important is that everyone who is on that vehicle at any point in time, they must all be wearing a mask. All right. They must sanitize. All right. They must conduct themselves in a manner to prevent the spread of disease. All right. That is the most important factor right now. Everyone must be wearing a mask and wearing it appropriately. All right. That is the only way you're going to ensure that persons who are conveyed in the type of transportation that we have will be safe. So at least that is my opinion on the subject, and I do not believe that a change in that area is needed. What is needed is a change in the behavior of the people who use the transportation.
Thank you, Dr. Charles. While you have the floor, I'll ask you to bring your closing comments this morning. One thing I would want you to include in your closing remarks is to, well, there seems to be some concern that you indicated, I'm sure you didn't, that only vaccinated children will be allowed in school. There seems to be some concern about that. So can you address that as part of your closing, please?
I have no idea where they got that from. We must understand that vaccines are designed, all right, the objective of vaccination is to prevent severe disease, prevent hospitalization, prevent death, all right? These are the three outcomes that the vaccines prevent, all right? I'm proposing that we vaccinate our children to protect them from any of these consequences, all right? And so that us as parents can, breathe a sigh of relief that our children can go to school as normal once again. But in addition, remember, children can bring the disease home to parents as well, all right? So, no, all right? I'm not saying that the children must be vaccinated or have to be vaccinated to return to school. All right, I'm encouraging everyone to get their children vaccinated so that they are protected from the consequences of this disease, because we know what the school environment is like. All right, we know what the school environment is like. So I encourage all parents, protect your children. All right, just like you have done for years with other vaccinations. All right, protect your children. I have done so. My two sons got their vaccine this morning. They got their first shot this morning, and I'm hoping in the next 3 weeks to bring them back to take their second. So that is my encouragement to parents. Now, with regards to where we're at right now, I would just like I just want persons to understand that, listen, we are where we are right now. All right? And when you are at the bottom of the ladder, they say, when you are at the bottom, the only place to go is up. We are where we are right now. All right, we must do everything in our power to get out of this situation. All right, so we want persons to behave in a manner, to behave in a manner that will get us out of this situation. All right, we need persons to wear your mask. Wear your mask when in public. All right. Avoid going out if you don't have to. Why do you have to go out all the time? Avoid it if you don't need to. All right? Avoid mass gatherings. Avoid crowdings. All right? There are still persons that are crowding by the barbecue stands and by the bars. It's as if they have not received the message yet that COVID is here. It is here. It is here. Don't wait until it affects your family to take it seriously, because by then it might be too late. All right? So avoid those crowded settings. All right? Wear a mask. Sanitize. Get vaccinated. Protect yourself. Now I want to specially mention that those families where there are elderly persons, and those families where there are persons with underlying health problems, you must be even more careful, because right now, what we saw when this outbreak started is that it affected a lot of young persons in their 20s up to 40s, because these are the persons that went out there and moved around and interacted, and these were the first ones. Then we start seeing children affected. All right? Because those individuals have children. They carry the disease back home. But what we fear is that they will now carry it home to granny and aunt and uncle and whoever is at home. These people that have been hiding themselves away and shielding themselves from this pandemic. And some of whom were confused out of their minds by some of the information that is going around. So they have not yet been vaccinated. What we fear now is that these young people will now take the disease back home, and in the next 2 weeks we are going to start seeing the consequence as we get the older folks coming down with the disease, and unfortunately we know what follows when this disease reaches this age group. So we ask for everyone to be responsible. Think about your family, think about your neighbor. You have to be your brother's keeper. You have to be responsible. You have to not live for yourself only, you have to live for everyone else that is around you. Because you might get it and recover, but the next person you gave it to may not. All right? The disease is here. We must do what we must do now in order to prevent it from spreading and to protect each and every one of us in this country. Thanks.
Thank you very much, CMO. Minister, final words this morning?
Yeah, just to add that I too, I have a daughter who is under 18, and she will be getting vaccinated today as well, thanks to the human service being provided by our nurses here at the Ministry of Health. And I know many other responsible parents are bringing their children to be vaccinated because school is opening, and we have not had a vaccine for persons under 18 available in Grenada before. So I am grateful for that and encourage others to bring their children between the 12 and up to get the vaccine. School is opening, and we do want to protect our loved ones as best as possible. It is a choice, and it's an individual choice parents take. I am clear on my choice. Dr. Charles is clear on his. Our vaccination sites remain open now with 2 choices of vaccines, and we look forward to people coming in, please, to be vaccinated. I also want to encourage those who have taken their first dose to make sure that you take your second dose to complete the entire process. Whether your first dose was AstraZeneca, make sure you come and take your second dose of AstraZeneca. If your first dose is Pfizer, make sure you come back to take your second dose of Pfizer. With respect to where we are now, we've said, Dr. Sean Charles has said, our Prime Minister has said, and many of us out there will acknowledge, we are here because we are all in this together. We got here collectively. We got here collectively because of what we collectively did in the last month. We will get past this, or where we are at the end of this month will be dependent on what we all do collectively, how we deal with this collectively. I've looked at some of the comments as we have been doing this live broadcast, and there's been a significant amount of deflecting, you'd say, from individuals. Yes, Dr. Charles and myself are in the limelight here now, and if you want to cast blame, cast blame. But we are the ones also with the responsibility to get us out of this. And we will do so to the best of our abilities. But whether you like us or not, what is more important to us is that we cannot do this as a nation unless we all do it together. This goes all the way down to the villages. Yes, you're asking which village, and that's why I'm saying yes, we can release that. But it goes down to the individual communities and villages. We say it takes a village to raise a child. It also will take the individual villages to stop the spread. And their own activities, listening to your neighbors, monitoring your neighbors, helping your neighbors. If we know of a neighbor who is waiting on test results or so, call on them and ask them if they need food or so. There is a way that we can help individuals who are in an isolated household without infecting ourselves, and therefore let them know that they don't need to leave the house. That we will assist. We will drop food at the door, and then they can come and get it. or at the gate. So we need to help each other. And in doing so, they also know that we're watching. We've told you don't need to leave. I will or we will help you. Therefore, we're watching. Don't leave. There's some people who, unfortunately, based on the luck of the draw, timing, etc., who also have been planning wedding, birthday, and then some people based on God's timing may need to be saying their final farewells to loved ones during this period of restricted movement. We ask you, please, it is essential under all of our religious beliefs that we give our loved ones their last rites, their blessings, that we attend to those, but to keep it to the numbers. How much we loved a friend, a neighbor, or work colleague is not determined by us being present at their funeral. If we step back and allow other loved ones to be there so that the numbers remain at the 20 or as close as possible. And I want to commend the churches that have been ensuring, and the funeral agents, that ensuring that where they are in control of the situation, at the church, etc., or at the funeral homes, that the numbers are maintained. But in the public cemeteries, in some cases, the numbers are not. And I'm asking individuals, please, for the next couple of weeks while we are at this period of heightened risk, to maintain those smaller numbers, please, at funerals. And those who have had weddings planned, please, a wedding does not make a marriage. We will get through this, and we will look back on this. We will get through this the same way almost all other countries are getting through it. Through vaccination, through the following of protocols. That is how we get through it. We will give you regular updates, and we will inform. We will update again the next time that we are going to be faced with a significant decision with respect to schools, etc. And I've seen questions and comments asking. We are going to be monitoring. It is not practical to make a decision now on the opening of schools. We do need to look and see the rate of cases, how quickly those cases are increasing, how diverse they are with respect to geographical location and age groups of the cases as we proceed over the next couple of days and into next week for us to actually make that decision. But right now, I think people are asking, and we need to recognize the reason that each of us are asking about schools is because we're very much aware with the presence of community spread that changes the goalpost with respect to schools as well. So yes, it is something that we need to monitor. And most definitely, those who are in that vaccinated age group, please, it's going to make a big, big difference. If your child is 12 or over, it's going to make a big difference having your child vaccinated before he or she attends school. There is just about enough time that they will get their second dose possibly within the first week or two of schools opening, if schools open on time. So we're going to come back to you as often as possible. We release our dashboard daily. Please look, please monitor for yourself the rate of cases, the increases in cases, hospitalizations, if any. And God forbid, yes, the possible inevitable based on number of cases, what we don't want, but the death. This is a deadly disease. This is why we're taking these measures, because it's been killing people everywhere else. And we're trying to prevent that here as best as possible. Let me end by thanking Dr. Charles and his team, our Chief Community Health Nurse, our nurses who are out there on the front lines, who in the past week have been under extra and additional stress, those who have been manning our hotlines. And I see individuals have been proactive. I've seen some proactive comments. A person saying they'd like to volunteer to man a hotline as opposed to a person just complaining to say nobody answered my hotline. And I want to congratulate those. That's how we get out of this. By each and every one of us stepping up to do our part wherever we are able or willing to do it. And not sitting back and saying somebody else has to fix it. Please. We all have to do our part. I have every faith in us being able to do our part. We put aside our differences. COVID does not respect the politics of Grenada, the religion. It doesn't respect any of that. It just wants us to gather. It just wants us not to listen to the facts. And it will be here. And it will wreak havoc. So please. We're all in this together, and therefore the only way we can get out of this is together. Thank you.
Thank you very much, Minister Steele, and also to you, CMO, for your closing comments. As we wrap up this morning, I just want to take a quote from the Prime Minister's most recent national address, and it follows on. It's in keeping with what Minister Steele was just saying. We must work together, the Prime Minister said. We must unite. We must synchronize our efforts, particularly during this challenging period. And that's essentially the message that you've heard repeated here this morning. We must all play our part in this. The Ministry of Health, the health workers, the health team, they're doing what they can. They're fulfilling their responsibility. As citizens of this nation, we must fulfill ours and be responsible in our actions. Protect ourselves. I am Philomena Robertson. Thank you so much for joining us this morning. We look forward to seeing you again next time.